Hello everybody, this is Jeana at Art of Skincare, and today we have a really important guest. But before I introduce her, I really want to set this up well. I want you to have a good introduction to what our conversation is going to be about. So last week we talked about menopause. When you hit 40 to 50 and the skin really starts to change on your facial area. Today we're going to take that a little bit further down. We're going to talk about what happens to that tissue in that vaginal area. It's a topic that does not get talked about enough because it can be a little uncomfortable for most of us, but it's very important to have this conversation because you don't have to suffer. There are things that we can do to improve the skin down there. So first, before we dive in with Sasha, I really want to give you guys an idea of what's actually happening down there. So as we spoke about last week, we have estrogen receptors in our skin. Most commonly, those estrogen receptors are found in the face, the scalp, and in the vaginal area. The vaginal area is also an area where we have very, very thin skin and very delicate skin, and yet it takes the most beating, right? From riding bicycles and exercising to having childbirth and our intimate activities. It's an area that gets a lot of use, but doesn't get a lot of care. So what we see down there, as our estrogen levels drop, we start to see that skin thinning, getting drier, we can have atrophy, we start to have incontinence, and a whole host of a cascade of issues that happen pretty much from 45 on. The first 5 years are the worst, but then it we steadily see an increase in that collagen loss even after that first 5 years of menopause. So in the first 5 years, we see a 30% loss of collagen. Then from there on, we're seeing a 2% loss after that, and we're seeing a 1% loss of elasticity after that. So there's a lot going on and many things that we can do. We know that there are some invasive vaginal things that we can do, but there's also some non-invasive things that we can do, and that's what I want to focus on today. Number one, as we mentioned with the face, hitting those estrogen receptors in the skin so that they keep producing collagen can be essential. And there's a couple ways you can do that with the skin down there. One way is to working with both ways really, working with your HRT specialist, your hormone replacement therapist, whoever that might be, whether it's a gynecologist, a natural doctor, finding somebody you're comfortable working with and using either an estrogen cream or a testosterone cream. Both of those can be super effective for that area down there, but you have to work with a professional because you need to monitor the estrogen levels and the testosterone levels in your body to make sure that you're on the right track and you're not using too much. The second thing that I see a lot of my clients and myself, family members, have great results with is using acupuncture. Going to an acupuncturist, you can have a treatment that most of them call it's a treatment for a prolapsed uterus. They actually put the needles around your belly button area, so you don't have to worry about needles down there. But this goes in and works from very deep within, up in the uterus area, and really lifting and pulling everything up. And everyone that I know that does a series of those sees a big difference and feels a big difference. Even their partners notice a difference. So that can be very helpful for you. But now there's another technology, and that's why Sasha is here today. And this third kind of treatment that we can do is what we call the CO2 lift carboxy treatment. This is creating kind of a hyperbaric chamber around the vaginal area that actually increases collagen and does a whole host of things. So I want to let Sasha answer questions on that. Sasha is with us today from Lumisk. Lumisk is a company that makes the Carboxy lift masks for the face. You guys have seen me do these on people here in the studio, and they have one for the vagina area. So today we're going to focus in on the vagina area. I think though that Sasha might share a few pictures of some of the face treatments so you guys can just get an idea of how powerful this treatment is. But Sasha, welcome to the show today. Tell me, introduce yourself. let us know, what are you passionate about? What gets you so excited about working with Lumisk at, am I pronouncing it right? Lumisk?
Yes. Yeah.
Lumisk.
Yes.
What gets you excited about working with Lumisk and what you're doing with your career right now?
Well, thank you so much for having me. I'm really excited to be a part of this conversation, a conversation that I think we need to be normalizing as women because this topic can be so taboo. But for me, I'm just really excited to see options for women that haven't been there before, and this hasn't been a focus. So now we are finally able to, offer some treatments for women that can really help with, regenerating that vulvar and vaginal tissue, which can, increase a whole host of benefits for the
Yeah,
woman.
yeah,
Yes.
lots of
So,
stuff.
as you said, we're using the power of carboxy therapy to regenerate that tissue downstairs. So,
Okay,
the way that carboxy therapy works is by mixing two different products together. So, when we mix these two products together, we're going to get a chemical reaction. It's going to create carbon dioxide gas, and the gel is the delivery system to the body. So, it's a transdermal delivery system of that CO2. Of that carbon dioxide into the skin. And then the body is going to respond with something called the Bohr effect. So the body responds by sending oxygen rich blood to that area, which increases vasodilation and increase in flow motion. We get additional growth factors, neocollagenesis, and increase in elastin, collagen, all of those things. So we're actually structurally changing the tissue of the vagina. Not only that, but we're putting the product internal, so we're getting all those benefits internal, but we're also putting it externally, so we're getting a really beautiful cosmetic improvement as well.
I love that. We are not today on the show going to show before and after pictures down there, downstairs, as you say. I just probably not appropriate on YouTube, but I have seen the before and after pictures. So I know that you've worked with some of the local doctors and you've seen
Mhm.
some of the studies that they've done and the
Right.
before and after pictures they've done. And last time you were in my office, you were so excited about it and shared some of that. Can you tell us a little bit about what some of the different doctors? I know one of them is, he calls himself, I think, a gynoplastic surgery.
Cosmetic, cosmetic gyne. Yes,
A
Dr. Michael Reed.
cosmetic gyno, right.
Yes, he has
And
had
he's out of Beverly
beautiful.
Hills, and he also works out of Davis, which is near me, and then another doctor that you mentioned. And so share with us what these doctors are finding using this. Now, I know some are using it with lasers, some are using it just by itself. Can you tell us about that?
Yeah, absolutely. So I am hearing so many success stories, and it's just amazing all of the different ways that this product can be used and what the different symptoms it can treat. But as you mentioned, Dr. Michael Reed is using this with a ton of success. He's treating patients with lichen sclerosis. And we aren't able to show these before and afters, but let me tell you, they are truly yeah, they're truly impactful, just from the outside, and then seeing patients internally. One patient in particular I can think of that I've heard this patient's personal story, was suffering with lichen sclerosis, was not able to have vaginal intercourse with her husband for a number of years, and went through a series of treatments. So this patient did 10. So as you showed that. We can offer the 5 count. We recommend doing a series of 5 every day for 5 days. That keeps that signal going. And then if you need that additional treatment, you would do the second set of 5 the following week. So this patient did a total of 10 treatments, and the before and after of her vaginal area, you can just see such a massive improvement in hydration, in tissue quality. I mean, it looks like she's, reversed in age 10 to 20 years, to be honest.
It does. I've seen some of those pictures, and where the tissue is just very thin, very delicate, it looks like it would rip very easily, to, what was it, 10 treatments later, it is plump and full, makes it look more lifted because it's just plumped up, kind of like we think of a balloon. When we put more air into a balloon, it lifts up. It's the same with our face. When we get more collagen production going on, it fills up. And I saw the same in those pictures. Now, I have a slide I want to show people that you shared with me that got me super excited. And I'll bring it up now, and then you can tell us what we are looking at. So I know, can you see what we have up, or am I the only one that can see it?
I'm not seeing the slide.
Okay, Sasha, the slide that I have up is the slide with the purple baseline and then 4 weeks later. And this is using the Carboxy treatment with, I believe, a CO2 laser resurfacing. And the
Yes.
studies have shown that without using the Carboxy, there's actually a decrease in the collagen layer in cell regeneration. But when you use it with the Carboxy, you're seeing huge amounts of change at week 4.
Yes.
And
So this is some of our newest data that just came out. This was Dr. Saronia Wiles and Dr. Ava Shamban that just came out with this data. So they essentially did a study where they had pairs of patients that were going to be receiving a energy-based CO2 laser. So both patients had a CO2 laser. One got an occlusive barrier, so just a Vaseline over the top of the laser treatment. The other patient received an entire protocol of the Pro. So this again just demonstrates the tissue regeneration with these products. So patient pre-treated with one treatment had a treatment immediately post-laser, one the following day, and then on day 4, and then the following week and the week after. So that was the doctor's protocol. And what we're seeing is in the histology, and you can see on that slide, is both patients have kind of a similar baseline. I believe one patient is she 51, and then the other is about 20 years older in her 70s. And the
71,
patient,
yes.
yeah, 71. So the older patient, the patient that was 71 that received the protocol of the Pro, in addition to the laser, had a 2.5 times thickness in her epithelium. So this is just really demonstrating that we're actually seeing structural changes in addition to the healing benefits that we get when we put it on topically.
I love that. I mean, yeah, for people looking at it, that where we're so excited when we're looking is that little deeper purple area and just how much more healthy tissue we have in that area. Let me bring up the next slide for everybody because I think this one's exciting too. So this slide that I have up, Sasha, is this slide that shows the oxygen concentration and the microcirculation and all the activity of the oxygen in the connective tissue.
Yeah,
Down
so
here it says
is this as a
microcirculation
stimulator?
improved by 28%, 75% increase in oxygen after the use of the treatment gel. So talk to us about this one too.
Yeah, so what we're seeing is hyperbaric chambers have been used to help patients heal, right? And there's been some different types of modalities that have been a little invasive. There was, providers were using needles to inject carbon dioxide into the body because they were seeing this as, a very beneficial treatment. However, that can be quite painful and it can be quite expensive. So this is really getting those same benefits as a hyperbaric chamber, but with a topical transdermal delivery system. So we're
I
getting that
love that.
oxygen to the body because we're sending
Yes.
in carbon dioxide, and the body's response is to send that oxygen to the area. I think there's another slide too that shows the actual mechanism of action. You can see the blood flow in the tissue, so you can see that those new capillaries and those new vessels pulling blood into that area. So we're
Yes.
getting the new formation
I'll
of new
show that
vessels.
again so everybody can see it. Yeah, you really see a lot of action. Just
Right.
increase oxygen happening in there. Super exciting. Now we couldn't show you guys before and after pictures down there, but I did grab some before and after pictures with the face. So the first one I'm showing here, before and after, you can see a real difference in her PIH, which is that post-inflammatory hyperpigmentation that you can get from breakouts. You just really see that evening of the pigmentation. She had 6 treatments in 30 days. So this is 1 month apart, just 1 month, that much healing. Let's dive down to the next one. I really love this one. I think we got this one on our website. But this one is, let's see, 45 minutes. Oh, treatments, 1 time a week, 1 time weekly, before and after. Oh, 3 treatments. Sorry about that, you guys. So it's 3 treatments. See, before, after the first treatment, the second treatment, and then the third treatment. And in the after the first treatment, you still see quite a bit of crepiness on the cheeks, under the eyes, around the mouth area. Go to the next week, already a significant change. You go to the third treatment, and we've seen this too in here in the studio, playing with this. by the third treatment, you are seeing amazing changes in that texture of the skin. Would you like to talk about that, Sasha?
Yeah, so I think we're seeing, a ton of improvement again in the tissue quality. So we're seeing hydration, and the same thing goes for down there. So I wanted to talk a little bit about what some of the things that we're treating down there are, because we do spend, as you mentioned earlier, we spend so much time on the skin on our face, but we often neglect the skin of
Down
our
there.
lady parts. Yes.
Yes.
So so we get the same host of benefits. So we get that hydration. We're going to get improvement in circulation and improvement in the tissue quality. So this is great for anybody that has vaginal dryness, anyone who has itching or burning, or needs just, like I said, an overall appearance, depending on the severity of the patient's symptoms. This can be also a preventative treatment and increases sensitivity. So, yeah,
So that's a good thing.
yeah.
So really, and working even with atrophy in that area or leathery tissue that can develop in that area, people who've had different treatments or injuries in that area, this is doing a great job of rejuvenating the skin tissue
Absolutely.
down there so that life is more enjoyable.
Right. And going back to the hormone conversation, we heard a story from one of our very own here at this wonderful company who had, gone through cancer and gone through chemotherapy and said, everything down there had essentially dried up like a riverbed. Right.
Yes.
And so that's
Atrophy,
when it comes. Yep, exactly.
leather,
And
yes.
that patient had 15 total treatments, but she said it was absolutely life-changing for her, life-changing for her marriage and her relationship, and her sensitivity as well.
I love that. Really
Yeah.
amazing. So let's play with it a little bit, and that let's show people, because there's a little technique to
There's
mixing
some
this
tips and tricks
up.
to application to making it a little less, we want it to be as easy and as less of a mess as possible. So I often recommend using a panty liner. Patients
Yes.
can sleep in this. There's no issue with leaving it in overnight. So that is an option. Or you can, put the product in, leave it for 45 minutes, because that's how long that carbon dioxide is active for. So she's going to put the big packet in first. Perfect.
Here's, see, you guys can see me squeezing it in, so you know what it looks like. It's this beautiful
Gel.
peach gel.
Mm-hmm.
I'm going to squeeze it all out into the bowl. Now I've noticed that the smaller packet can sometimes be a little trickier because it's a stiffer product. And you told me, you promised me you would show me some tricks on this. So let's do the trick way. I could just cut it and then try and squeeze it all out, but let's do the trick way.
Yes. So in my experience, sometimes it can be like you want to massage the packet to push it out. But if your product is, kind of stuck in a corner at one end, I would just recommend cutting it long way, and then you can just scoop your product out. Yep.
Well, I got to cut a little lower than that. Okay, now I can open it up.
Mm-hmm. You can put your application stick and just scoop it right into the bowl.
There we go. And I'm going to use my plastic stick. Go in there and, oh yes, it is so thick in there. I think I've been missing parts that are hanging out in the corners. Okay, and we're getting that into our bowl.
Perfect. And if you're at home, you would want to mix this for 1 minute just to make sure that you have that carbon dioxide activated.
And that's why they're in two separate containers. I've had people ask me, Sasha, can I just use half and do one treatment and then use the other half the next day and do another treatment? What are your thoughts on that? So I'm going to go ahead and start mixing here.
Yeah, so once the package is open, we don't want to compromise the integrity. So it's a one-time product, unfortunately.
Yeah. There's no way I know sometimes we talk about sheet masks where you can maybe get one more use out of it the next day if you keep it in the refrigerator, things like that. But with this one, no go. It's all or nothing. And especially, I can see sometimes on the face, people think they just want to treat one area, maybe just the mouth. And so they're thinking that they don't want to use the whole container. But you may as well use the whole container because you're going to waste it otherwise. But on the face, we do this treatment. We treat the entire face, even over the eyes and the neck. There is not really enough to do a full neck décolleté with one bag or one set. I find that I have to do one set for this area and then I do one for this area. Is that what you find as well?
Yes.
Sasha? Yeah. So as I'm mixing, there was little white lumps in there, and I'm just breaking those up and getting it all nice and gel-like. So cool. All right, now the next step is that you get this syringe in the package. So we've got to pull off the cap. And then down here in the syringe part, step 2, you have to break the seal. There's a little seal that if you pull, you'll feel the little suction go pop. And then we'll be able to load the syringe. So let me go ahead and load a syringe. Let's see if I can get it up higher. Can use my water bottle. So I'm gonna get it in the corner there and just suck it all up. There it goes. Play around with it. The first time I try to suck, this happens every time. It only gets a little bit, so then I squirt it back out and I suck back up, and then it comes up the second time.
And if you hold the syringe,
usually you're going to get 2 or 3 full. Once I have that, I'm going to insert this and put it right up inside. Any tips about that?
No, I think, it's pretty, I think as women, we're used to, some products that we've had to use down there. So it shouldn't be the first time, but yes, and it should be a very pleasant sensation as well. Something I will note, not everybody experiences this. I know when I tried the product, I did. You can sometimes get a feeling of like a rush of warmth. So it almost feels like you're wearing a heating pad, and that is the blood coming to the area. So I have certainly experienced that. And that is, that's something you might experience in your first couple applications.
Absolutely. So depending on how much I get, I'm usually 2 of these up inside, and then there's a little bit left over, and I'm putting that around the outside area.
Yes,
then I'm
exactly.
putting on my period panties, my Spanx. Of course, I'm not at that age where I get periods anymore. But I also have some incontinence underwear, Spanx, that they're not Spanx. What are they called? They're something like Spanx. But I wear those all night to catch all that little extra, all that stuff that's just going to generally seep out throughout the night. And that's it.
Perfect.
It's so easy. And it feels, makes quite a difference. So I love this. We have some guests on the show today. I want to open up to any questions or concerns, anything that our guests might want to know about what we're talking about today. While we're waiting for any questions to show up, at what age can you start using this treatment?
So honestly, it just depends on the needs and the severity of the patient's symptoms. This is something that you can use preventatively. You can use this to just increase sensitivity and hydration. This is great for the pH of the vagina and the barrier, the skin barrier, right? So if a patient or a person is having challenges with, repeat UTIs or repeat yeast infections, this is going to help improve the overall ecosystem of the vagina, the biology of the vagina.
That
Yeah,
was my
so this
next question is, yeah, what do you do if you have pH issues down there or you have a little bit of yeast going on down there? We often think, oh, I shouldn't put anything up there, but this actually helps
this actually
with that.
helps.
It's going to
Yes, because
balance that.
it balances the pH and improves the tissue barrier, which is all needed to prevent or to keep that healthy microbiome in the vagina.
That's awesome. Really
Yeah.
awesome.
But if you
Let's see.
are postmenopausal, you may need more treatments just because if you are suffering from severe dryness, you may need those additional, that additional 5 treatments.
Okay, so when we're talking about this, picking up, we sell sets of 5 because just doing one treatment, I mean, you're going to see a little benefit, but it's not going to do that rejuvenation that you want. So we have sets of 5. How often should we do this treatment in the beginning? Like when I first get my box of 5, should I do this every night, every other night? What are we talking about? What do we need to do to get the results that we want?
So Dr. Michael Reed recommends a minimum of 5 for everybody, and it would be consistent daily use. So for those first
Okay.
5 days, it should be Monday through Friday if you can make that work, right? Because you're keeping that signal alive in the tissue. So he says that you'll start to see a change around 3. So 5 is really going to get us there. Now,
Okay.
if a patient has severe symptoms, they may need an additional 5 the following
Yes.
week. So we
Right.
would
If we've
recommend.
got vaginal atrophy going on or more
Mhm.
injury down there, we probably
Right.
need to do 2 sets of 5.
Exactly.
Okay.
Exactly.
So we're going to do it 5 days in a row. What about maintenance? Do I need to do this once a week after that, once a month? Do we have any research around that? What do we need to do to maintain?
So it's a great question, and it's something I've been asked a lot. And I think it's maintenance is going to be important because as any tissue ages, right, and we improve it, it still continues to age. So we might get it to the place where we want it, but we still need to maintain it to get there. So it might be, an additional series once a year. It might be monthly treatments. It's all just depending on how, you're feeling and the
What
results
you're
that you're
observing?
seeing. Yeah,
Okay.
absolutely. But as we know, what we do to our face one time is not going to be the be
No.
all end all. It's a constant process to keep.
We wish that. I often get clients that say, well, can't I just use that and be done? Do I have to keep doing it? But we know that with life, with aging, everything wants to stagnate and slow down. We've got to exercise more, be more active. We've got to take better care of ourselves. Everything is just wanting to stagnate. So in order to keep that from happening, to reverse that, we've got to first be really aggressive with those 5 days and then figure out a once a week or some kind of a plan, maybe once a quarter, do 5 days once a quarter, see how that works for you. Observe and see what helps maintain that healthy, non-stagnant, what would be the opposite word of that? Just to have that healthy regeneration, oxygenation, blood flow, all of that going on down there. So we have a question here with Cindy. She says, is there any downtime for this treatment?
There's no downtime other than the period that you have the product inserted. If that's something
Right.
you don't want to go into public, then you would just use in the privacy of your home. Again, the product's active for the 45 minutes, so you can remove, take a shower, however you choose to clean up, and there's no downtime.
Yeah. So if you want to use it as your meditation, yeah, put it in, put your feet up, put on some good music. 45 minutes is your treatment. If you're like me and you just don't want to sit still for 45 minutes, before bed. Load up before
Really
bed.
great.
Yeah. And then in the morning, rinse, and then repeat the next night. Yeah.
Yes.
Wonderful.
Perfect.
Well, I don't see any other questions. I'm sure that we're going to be getting questions and comments later on through the week as people get a chance to watch, because this is such an important topic. And I really appreciate you, Sasha, being here so much. I think it's an embarrassing topic that most women don't want to talk with even other women about, and they just don't know that there are options and things that can really help. So I'm glad that we're having this conversation, and let's just keep it going. I would love to have you back in a few months and let's talk about it again, because I think that as women, we used to not live this long, right? We used to live into our 50s, and that's why we still have eggs being produced, and we could still have children up until we hit 50 to 55, and then our life was done. But it's not that way anymore. We are not done at 55, and so using things that help to regenerate and improve our lives, good HRT therapy, exercise, all those really, I think for me, my life almost began at 55 because I love my children. I raised 3 daughters and I stayed home with them, and I didn't really start my career until late in my 40s. So by 55, my life was just beginning. And I feel like even now at 62, I'm at the height of my career and I'm just so in love with it and having so much fun with it. So we have to find these things that help us to improve that longevity in our bodies, our minds. And I think that this tool, their Carboxy system, CO2 lift Carboxy system, is just another wonderful support that helps us to keep that youthful vitality that we all want into our 80s, 90s. Isn't that great? Yeah.
Beautifully said. And I just want women to know that they are not alone, and that this, is something that so many people experience, and that it's okay to talk about it. And I'm here to help normalize the conversation and support women on their journey.
I think that's so great. I recently was at an engagement party, and everyone there had a couple glasses of wine under their belt, and one of the women my age pulls me over to the corner, sits me down in the couches with the other women, and they just want to know, because they know I'm a skin person, they want to know what's going on with the skin down there. And it was such a fun conversation to have with them. I'm suffering with repeat UTIs and bladder infections and incontinence and thinning of the skin and pain during sex. All those things are real things that at a very young age, at 60, we're dealing with, and we don't want to deal with those things. So I'm so excited, Sasha, for you to be here today. Thank you so much for sharing all of this, and I can't wait to have more people try the system and to get to hear the great stories we're going to hear. We're already hearing them about the face, so communicating that to this other treatment is fantastic. Yeah.
Wonderful. Well, thank you so much for having me. I really appreciate it.
Yeah.
It's been a pleasure.
Wonderful. Have a great day, everyone, and we'll see you again next week. Bye-bye. Get off here.